welcome to ThisDay for this Thursday, August 27th. Thanks for joining us today on the program. Well, today on our program, Lisa Hart is going to be able to speak with a couple of doctors, some really good medical information that I think you'll find important. At first, she's going to talk to City of Hope, and that's going to be Dr. Heng T. Tang, and she's over there at the City of Hope. They have a new location in Newport Beach, and she is a surgical oncologist. And also we'll be talking with Dr. Mark Stein. He's with RadNet, and he is a radiologist over there. You know, RadNet is real close to us, right off of Paseo de Valencia, and has done a partnership with Memorial Care. So we'll be talking to them. One of the biggest points they want to make with you today is that if you have any doctor's appointments or you have to go see a radiologist, make sure you keep those appointments. They've done a lot of work in working with precautions in COVID, so be sure and keep those appointments because that could lead to other problems later on. So be sure and follow up with your doctor when you have those appointments scheduled, and they will take good care of you. Well, let's talk about some of the meetings that will be happening, and that's going to be only one meeting for today. That's the United Agenda Prep, and that's going to be at 2 o'clock this afternoon. You can see that on LagunaWoodsVillage.com/meetings. So if you live over in United, they're going to have their agenda prep meeting. That's going to be at 2 o'clock this afternoon. Well, let's give you some of our reminders that we usually give you, and that's regarding our COVID-19. And these are some updates and information. Orange County is doing a terrific job, and Laguna Woods Village is doing an even better job of preventing the spread of COVID. And you can go to OCHealthInfo.com or go to the CDC.gov, and that's going to give you the staying safe with COVID-19. And of course, the other one is the California.gov, and that's the one that the governor kind of has his reopening plans and some other information, so you can give any of those websites a look. Jeff Parker will be on our program tomorrow, and we'll be discussing, how we're doing and what our numbers are like for the next week. I believe we're off the list now for 4 days, so hopefully that continues. You can always go to LagunaWoodsVillageAlerts.com as well to get our information here in our community. And send us an email at info@LagunaWoodsVillage.com if you have any questions or comments. Hey, let's take a look outside. It's going to be another warm day today. If you're watching our morning program, it is already starting to clear up. It's going to be probably the hottest day of the next week here. It's going to be 91 degrees today. Overnight, 66, but the next couple of days, you'll see the temperatures slowly go down, and we should have some nice, cooler days in the next couple of days. As Mark says, on Sunday, we're looking forward to that Chamber of Commerce weather on Sunday, 82 degrees with a nice 62 overnight temperature, and but still pretty warm. Not too bad, though, especially once we get into the weekend. But today, definitely going to be warm, 91 degrees today, so be sure and wear that sunscreen and wear that hat. Well, let's take a look at our sunrise and sunset for today. Our sunrise this morning was at 6:22 a.m., early sunrise, and then of course our sunset this evening will be at 7:22 p.m. That's a beautiful sunset right there at Puerto Vallarta, and we want to thank Lori Malawa for sending that in to us. That's a beautiful sunset there. Great shot. I just love it. She's actually sent in a couple of terrific pictures, and we hope to include them as the shows go on. But great job, Lori. We love that picture. It's in Puerto Vallarta, a beautiful sunset. If you have photos you want to share with us, be sure and email us at LagunaWoodsVillageTV@gmail.com, and we'll be sure to include it with our program. Well, we'll be back with Lisa Hart and a couple of doctors right after this message.
Today, we are marking the beginning of a new era as City of Hope opens its first location right here in Newport Beach.
We have 500 scientists and doctors who have dedicated their lives to beating cancer. So they use that intellectual capital to try to make sure every patient gets the best care possible that's known to science.
Welcome back. Well, today I am joined by Dr. Heng Dang, who is here with City of Hope, and she is a surgical oncologist. Thank you so much for joining me. I hope I said that all correctly.
Yes, thank you very much for having me.
You're welcome. You're welcome. So, boy, you know, we were talking with some other people regarding breast cancer, and it just in cancers in general, cancer doesn't stop when we're going through all of this COVID stuff. I mean, it just keeps going, and it's very important to pay attention to any diagnosis, whether it's breast cancer or any cancer. But before we get into that, tell me a little bit about why you ended up in breast cancer.
It's actually because of a patient, and I encountered her during residency with an advanced stage disease that she didn't realize. And I thought it was actually one where it motivated me to become a breast surgeon and advocate for patients and give women a voice and educate them. So she might not realize it, but she did change the course of my career.
Did it take you much longer to actually go into that field, since it sounded like you were already a doctor and then you switched?
Correct. So I did my medical school residency. Then I went into a fellowship, breast oncology fellowship at the University of Pittsburgh. After that, I did a aesthetics fellowship, so for making sure that cosmesis and cosmetic results are great for patients. Okay. Then I went on and did I worked in New York for about 2.5 years before I returned to California. Okay. Because of the weather and my family.
Yeah, no, I hear you. A lot of people say, oh, we're just not going to live in California anymore. We're tired of the politics or this and that. And you're like, okay, go find someplace else that's got better weather. And then they come right back.
Yes.
So I can understand that. So gosh, with all of the new things that are happening at City of Hope with the new cancer center and the big great park presence, I mean, it's really a lot's been happening. So in regards to breast cancer and understanding it, what do some of our seniors need to know?
Well, breast cancer is actually a common cancer in individual over the age of 50. So it's more important for women to understand how important it is. There's about 50% of breast cancer occur in women over the age of 60. And so I advise senior citizens to actually go and get evaluated and determine their risk and talk with the provider to make sure if they qualify or in a high risk or low risk range to allow them to go for screening and have that discussion about risk assessment and different screening tools that are available for patients.
Right. And many of the patients over the last several months have been afraid to go and get their screenings or even once they have been diagnosed with cancer, they're afraid to go back. So what are some of the things that you guys are doing locally to help patients feel safer?
So as a cancer center, City of Hope as a cancer center, we are well known to make sure, hygienes, safety of the patient and the staff, because we have patients who are immunocompromised from chemotherapy that we deal with prior to COVID. So we understand that concept, and all we did was pretty much implement it on a larger scale and allow, patients that come in, they are screened with their temperature, questions about any travels, any exposure, making it feel safe for patients to come. And again, safety is our number one for patients to come in here and get evaluated. The other thing I also want to point out is that cancer doesn't stop during a pandemic. And by not coming in and not getting treated or evaluated, it can make the disease worse. So of course, it's very important for patients to understand that their health is number one. And we are here to make sure that we're able to make it as safe for them as possible. We wear masks, we wear shields, we do all these interventions to make sure that we provide safety for our patients so that they can feel that way. And yes, screening is an important part. Initially, when COVID started, the screening was a little bit delayed because they were focusing more on urgent, emergent cases. But as we don't know when this will end, we cannot predict. And so it is important for patients to not delay their screening and be able to actually go and get evaluated for.
Yeah, good point for sure. Now, what are some things that people could do in regards to healthy living or a healthy lifestyle to help prevent cancer?
Yeah, so that's part of the risk assessment, I would say, or risk cancer prevention. I would say that a lot of times there are things that we can't control, right? There's certain risks such as age, family history, genetics component that we can't control. But the other risks that we can control are usually associated with lifestyle modifications. And usually it's associated with reducing alcohol intake, avoiding tobacco, increase your activity, healthy eating, fiber, protein, nuts. Those are really good in reducing the risk of cancer, any cancer. And it's been shown that diet and exercise has that component and has data and research and trials has indicated. So I actually advertise to my patients and encourage them, you know, it's very hard in this time when we're very, we are quarantined, but you can go for walks, you know, you can change your diet, and maybe now you can cook at home. And if you're able to cook, you're able to cook a healthier meal. So I encourage patients to be aware of their diet, their exercise, the routine, lifestyle.
Great advice, because yes, good point on the walking, because we have tended, you know, we've been inside for some time now, but you can go walking, you can wear your masks. Many of our community is seniors, of course, and they're 55 and over. So some of them are at the highest risk for COVID-19, but they do have a mandate on masks, and it's really helping a lot in terms of spread. We've kept our numbers very low here in Laguna Woods, so that's a great thing. But I know you have patients from here, and so I wanted to be clear as to what are some of the things you guys are doing, and you know, don't put off being assessed and getting treatment, because like you said, it's just going to prolong what's going on with you. So wonderful. Any last words?
I would say I agree that, you know, mask is very important. That's actually the only thing that we as individuals can control at this point. We can't control the spread of it, I mean, extensive spread, but we can control it by wearing masks, not only to protect ourselves, but actually to protect our community. And we have to kind of fight this together. And that's the best way that you can do something, is to protect yourself. The other thing I would also recommend is make sure you have understand the safety of hand hygiene, and that, you know, that's one of the things that you can control. If you go outside, when you come home, make sure you wash your hands before you touch your face. Even with the mask on, if you have a mask and you continue to touch your face, it really is not going to be beneficial. Right. So I encourage my patients, when they go even to our office and they get home, wash their hands and then go on with their day. And I think that's something that would help prevent them.
Wonderful. Well, thank you so much for taking the time. I really appreciate it.
Thank you, Lisa. Have a good one.
All right, you too.
Thanks for having me.
You're welcome.
All right.
And we'll be right back after this.
Hearing aids require a lot of attention. Don't underestimate the problems earwax can cause. Come in and see inside your own ear canals to find out how much blockage you have. Debris like earwax can cause up to 45% reduction in amplification. Your hearing aids may be able to be significantly improved to help you hear conversations clearly with a simple office visit. Every day, patients say, "Oh my gosh, that sounds so much better." Stop in or call us today for a complimentary cleaning and ear inspection. Tell them Stuart sent you.
am joined by Dr. Stein, who is here from RadNet. Well, Doctor, it's very nice to see you again. How are you doing?
I'm doing well. Thanks for inviting me back. Everything is going well. I hope all is well with you.
Yes, everything's going good, and our residents are staying healthy as possible and wearing their masks like they're supposed to. However, it would seem that there's still many people who are afraid to have their imaging done or just don't think it's important. So I know you've got some things to say about that. So why don't we just start right off with, why do you think they're still afraid?
Well, I think there's a fear of going into unknown places in general. I think there's a fear of going into elevators. People are worried that this virus is easy to catch, and it is easy to catch, but you have to take precautions. And the most important precaution is the one that you mentioned at the very beginning: wear your mask. And we absolutely insist on that in all our offices for both our staff as well as our patients. And in fact, I'm not sure we will allow a patient in who refuses to wear a mask. We are trying to ensure that everybody wears a mask, and that we take every precaution possible, and to ensure that nobody gets the virus from our offices. We've had no incidents of it that we know of. And we have been very careful, and RadNet has been very proactive from the very beginning, ensuring that our staff are protected, our patients are protected, our physicians are protected.
So people are probably not going to their doctor either. However, once they do go to their doctor, I'm hoping that they realize that obviously your facilities are fine to go to. Missing a radiology appointment can't be good for people in the long run.
In general, it's not good at all. Patients are scheduled for appointments. Doctors do not order studies that don't need to be done, particularly in these COVID-19 days where everybody is aware that people are unsure of where they should go. So nothing is ordered unless it's really indicated. And that's something that we have noticed, that the indications for the procedures that we're doing are much more valid now. Sometimes people would just get an x-ray to just make sure. In general, right now, every physician is only ordering a procedure on a patient if it is needed.
So for instance, cancer, cancer doesn't stop. It just keeps going. I mean, any type of situation like that. And so people who stop having, like maybe they had a biopsy or something like that, and they were told, I'm not really sure what's the chicken or the egg, which comes first? Is it the radiology first and then the biopsy, or is it the other way around?
Well, initially we do an x-ray and we find something, and then we do the biopsy, or the biopsy is done by the physician, or occasionally there's a mess. The physician does the biopsy himself, comes up with cancer, and sends you for further imaging. Those patients, it is essential that they have their imaging. Once you are a known cancer patient, once you know you have a positive biopsy, you do need to get it treated. It doesn't mean you have to be treated in the next hour or so, but it's not something you want to wait a month or 2 months or even longer for. You need to get that imaging. Every procedure has a risk. There's tiny risk of going anywhere. And we need to make sure that we don't delay something on that small risk, and that the risk of the cancer getting worse is much higher. So you always rate up the risk and benefit. It's the same as going into a store. Do you need to go into the store? If you need to, you do it. But the cancer is far more important that you get the imaging and that this gets treated as soon as possible.
So what would you say someone should do in this case where maybe they were diagnosed at one point and maybe they're not quite at the point that they need to be seen right away, but what do you say to them to get them to say, hey, I need to come in?
If your doctor has ordered a study, my recommendation is you do it. You do not delay it. Your doctor is more aware of COVID-19 than most of our population are. They're not ordering the study unless they believe it needs to be done.
Okay. And then how can a patient lower their risk during a crisis like this in terms of really any type of thing? I mean, people aren't necessarily going in for their mammograms either.
We, interestingly enough, have actually not noticed a marked decrease in mammography.
Oh, good.
Have had some, there's no question, but there are patients who are delaying their mammograms, and if it's a routine screening and you delay a month, that's not a problem. But to delay much longer, my advice is get it done. I think the risk of coming into one of our offices is very, very low. We've now been in this pandemic for 4 months. We have offices, not just in Laguna Woods, but throughout the state of California. But my particular group covers the whole of Orange County. And we have not had any patient that we know of who has developed COVID from coming into our offices. We are very, very aware of the risks. We do not want you to stay in the waiting room if you don't have to. So if you have a telephone, you can come, check in. You can check in online. In fact, I've done it myself because I've actually been a patient and checked in online, and it was very easy. You come up to our office, you tell them you're there, you go back to your car. We will text you when you need to come in. If you have to stay in the office, we have social distancing within the office. We are very aware of it. Everybody is wearing a mask. We make sure that our technologists are wearing a mask, and we do the procedure as rapidly as we possibly can. And we clean the offices and we clean the equipment between patients.
Right. Now, if someone had a question regarding what practices you have been doing, where would you recommend that they go to or call?
They can go onto the RadNet website, or they can call any one of our offices and talk to the front desk people and our staff. Our staff know a lot about this. They are well aware of it, and they are used to having patients call. We encourage patients to do your due diligence. Make sure that you are comfortable coming to us. We have a number of our offices where you don't even go into an elevator. And we have the office next to Saddleback Hospital that is first story. It's a quick 1-story ride in the elevator. The office across at the old Orange County Diagnostic site that is now Wave Imaging, one of ours, you don't even go into an elevator. Our Irvine offices, no elevators. So we are aware of it. We do everything we possibly can.
Right. Well, and that's pretty much what most people are saying. Even hospitals and doctors are seeing, the decrease of visits. And most people are saying that I talk to, hey, I feel more safe in my facility than I would going to the local grocery store.
I have radiologists who are going into the offices. They're not doing that, they are well aware of it. If they thought it was high risk, they wouldn't be there, I can tell you. Right. And our staff as well. And we are very alert to it. We keep it. RadNet keeps a track of all the number of COVID cases that they have throughout their system. And be aware, this is over 350 imaging centers nationally.
Wow.
And so they keep a track of every case of our staff, and it's very little. It's I think it's 20 or 22 total in the entire pandemic. They analyze where they come from. And the one thing they found is that just about every case that was in an office, and none in our area, and I need to emphasize that, the staff were not wearing a mask. Oh. Wearing a mask, I cannot understand this aversion to wearing a mask. Maybe I'm a physician. I've been wearing a mask during procedures for 40 years. Right. I have not had a carbon dioxide toxicity from it. It is not that much to ask somebody to wear a mask, both for yourself, but more important for other people as well.
Okay, well, very well said, and I appreciate you taking the time. Hopefully people will stop being afraid and they'll get out there and do what they need to do.
I encourage them, call our offices, call our staff, look at our webpage, ask to talk to one of the radiologists if you're really worried. But we take every single precaution we possibly can. And when a study is needed, please do it. And that goes for screening studies as well. Okay. If you have a screening study, this pandemic is going to go on for a long time. We need to get those done so you can be treated. The risk of not being treated is far higher than coming into our office and the risk of COVID-19.
Absolutely. All right. Well, thank you so much. You have a great day. Thanks again.
Thank you. And thanks for inviting me.
Okay.
Thank you.
And we'll be right back after this.
Before we let you go, we want to remind you that our movie is tomorrow. That's going to be our Friday matinee, and then we have another broadcast at 7 o'clock. Our first broadcast is at 2 o'clock with subtitles, and our movie is Portrait in Black. This was produced in 1960, and believe it or not, they made a little over $9 million on this film back in 1960. It stars Lana Turner, Anthony Quinn, and I forgot to mention the last time I promoted this movie, Sandra Dee is also in this movie, and John Saxon, of course. So a terrific film. I think you'll find it intriguing at the very least, and that's going to be on Friday at 2 o'clock with subtitles and 7 p.m. without. And we do thank Memorial Care for bringing us that film and sponsorship as well. It lasts about 2 hours on Friday, and that's our movie for tomorrow. We want to tell you as well about a book club that's meeting, and that's with Google Meets, and that's from 4 to 5 p.m. And this is Join a Dialogue Society twice a month for an engaging book club discussion. And they'll be meeting right there in Google Meets, and you can get more information at info@Dialogue Society, or give them a call at 297-6592, and that is a book club. And it looks like they're meeting, like I said, about twice a month, and you're a avid reader. Sounds like something you might want to be a part of. Let's take a look outside real quick. It looks like it's going to be a warm day. It is a beautiful day out there, but just a little bit warm, and we're going to look at temperatures today that's still going to be close to 90 degrees, and overnight temperatures in the 60s for the next few days. Like I said earlier in the program, hopefully you got your walk in this morning and walked the dog and did some of the things you need to do around the house that we're kind of accustomed to nowadays, and hopefully just kind of relax this afternoon and cool off. Well, we thank you for joining us on our program today. Be sure and join us tomorrow at 9 o'clock, and you can also catch our rebroadcast at 12:30 and 5 p.m. I'm Paul Ortiz, and enjoy your day right here in Laguna Woods Village.
2020 Subaru Forester, the SUV for all you love. Standard symmetrical all-wheel drive plus 33 miles per gallon. Standard eyesight driver assist technology. A spacious and comfortable interior. The best SUV for all you do.
Irvine Subaru. Get your new Subaru here with 2 years complimentary maintenance included.